Now in the third section of our lecture, we will talk about some other functions tests, because besides the test we already talked, like about the Toynbee's test, then we talk about Valsalva maneuver, then we talk about the Politzer test. All these tests are performed to check for the function of the Eustachian tube. But in this section now we will talk about some radiological tests. Then we will talk about the saccharin or methylene blue test, and then sonotubometry. So radiological test is in this radio opaque dye. For example, we can use hypaque or lipoidal instilled into the middle ear through a pre-existing perforation. So if there is a perforation in the tympanic membrane, a radio opaque dye is inserted through that perforation. And then x-rays are taken to delineate the tube and any obstruction. So in this, if there is obstruction in the tympanic membrane, then the dye is inserted, which can be observed by the x-ray, and then the x-ray is performed if the tube can delineate the Eustachian tube. If there is any obstruction, then the dye won't be present in the Eustachian tube. It means it is obstructed. So if it delineates the tube and any obstruction present. The time taken by the dye to reach the nasopharynx also indicates its clearance function. So time depends. If there is any obstruction, more time is required by the dye to reach the nasopharynx. So Eustachian tube is the connection between the middle ear and the nasopharynx. If there is obstruction, or if there is a perforation in the tympanic membrane is the membrane between the external ear and the middle ear. If it's intact, we cannot put the dye in the middle ear. But if it's perforated, or if there is a hole in the tympanic membrane, a dye is inserted, and then that dye can go through the tympanic membrane, Eustachian tube, into the nasopharynx. So time taken by the dye, or if there is any obstruction, we can find that obstruction through this radiological test. Next, saccharin or methylene blue test. In this, the saccharin solution is to the middle ear through a perforation. So again, like in the previous, we put the radio opaque dye. In this, we put the saccharin solution into the middle ear through pre-existing perforation. Then we note the time taken by it to reach the pharynx, and it imparts a sweet taste. Saccharin is sweet, so once it reaches the nasopharynx or the throat, we can feel that sweet taste in the throat or in the mouth. Then the methylene blue test, again, is the test in which the methylene blue is injected through the perforation, and the time taken to reach this dye, and it stains the pharyngeal secretion blue. So that's how we perform this test. So in the first one, a dye is injected, and then the x-ray is taken to find out if there is any obstruction, and then how much it can delineate or mark the Eustachian tube. In the other test, we can inject the saccharin solution, and then what time taken to feel that sweet taste in the mouth or the throat. Then again, in methylene blue, we can notice the time it takes to color the pharyngeal secretions. Then another test is sonotubometry. Sono is the sound. Sono is for the sound, and then tubometry is for the recording of the tube. In this, we have the sound applied to nasopharyngeal orifice of the Eustachian tube. So what's happening? A sound is applied to the nasopharyngeal portion of the Eustachian tube, and then we put the probe microphone with signal analyzer on the external ear. And then we can record that sound on the, as a result, sound level on the external meatus, and then that is recorded. Result is 10 openings during 10 acts of swallowing. So this every time arrow indicates act of swallowing. So in this, what happens is a sound is applied to the nasopharyngeal end of the Eustachian tube through the nose. And then on the ear side, we record those sounds, and then patient is asked to swallow. With each swallow, there is opening of the Eustachian tube, and this is the recording or the effect of the sound on the Eustachian tube. Sound also has an effect on the opening of the Eustachian tube. So in this, sound is applied, and then from the ear that sound is noticed, and then patient is asked to swallow, and then the effect of that can be observed on the Eustachian tube. So that was all about some other tests performed for the Eustachian function test.